Hey guys, Dr. Childs here. Today we're going to be talking about the relationship or the connection between low thyroid states and acne. So if you are somebody who has acne and you believe it's related to your thyroid, this video is for you. In fact, there are many causes of acne, but thyroid is an important cause and one that is often ignored, or at least not the correct amount of attention is not paid towards it. So again, if you are somebody who has acne and thyroid problems, this is the video for you. We're going to be talking about the signs that your acne may be related to your thyroid. We're going to talk about how to treat it, and it'll kind of put the picture better together in your head. If you don't know me, I'm Dr. Childs. I'm an internist, and I specialize in treating patients with thyroid problems, helping people with hormone imbalances, and of course, helping people lose weight. But today is about acne and the thyroid, and you'll find that this actually crosses over into the hormone balance area. So as we get to the treatment, I think it'll make more sense. But first I want to talk about the fact that there is a connection between, again, mostly low thyroid states and acne. I don't know very many people who have had hyperthyroidism or high thyroid and who also have acne, but I do know a fair amount of people who have low thyroid and acne. Now there are certain types of signs that distinguish acne related to your thyroid from acne related to other causes. So I want to talk about those right now. And probably the most important sign is the fact that if you are older and you've never struggled with acne, let's say a 40-year-old woman, and suddenly you start to develop acne, there's a good sign that that is probably related to your hormones, and probably your thyroid is playing a role in that. And we'll talk about some of the other hormone imbalances like estrogen and progesterone and testosterone in just a minute. But again, if your acne just pops out of nowhere and you're not someone who normally has acne problems, that is probably a strong indication that it's related to your hormones. There are other things, though, that you can use to tell if your acne is related to your thyroid. One of those is that you have been diagnosed with a thyroid condition, and upon taking thyroid medication, things like levothyroxine, Synthroid, natural desiccated thyroid, etc., upon taking those medications, you have seen an improvement in your acne. Now, most of the time, this improvement may be minor, okay, but you will see some benefit to it because most of the time, thyroid patients, they're not treated properly, which means that even though they might be taking the right medicine, but they're not usually taking the right dose. So it's not completely going to go away. Well, it might, and we'll talk about the treatment if you do it correctly. But most of the time, for most people, if they just take a little bit of thyroid medication, they see an improvement in their acne, that may be a sign that that acne is related to their thyroid and not something else. Another sign is that you have cystic acne, okay? There are many different types of acne, but thyroid problems tend to cause really deep, painful cystic acne. Okay, and these are the kind of things that you really can't pick at because they're really deep, they're under the skin, they're red, they're swollen, your whole face hurts. That's the kind of acne that the thyroid causes. That is also the kind of acne that can be associated with high levels of testosterone, and that's the kind of acne that usually young boys get or women who have PCOS and things like that. But thyroid and testosterone both cause this really sort of deep, painful cystic acne. Another sign is that it is not cyclical. Remember, lots of types of acne, especially in women of all ages, is the cyclical type of acne, which usually accompanies the menstrual cycle. So I'm saying here, that is not associated with your menstrual cycle and it is not cyclical. So if it comes and it stays and it's just there, that's probably a sign it's related to your thyroid. If it comes and goes, at any point in your cycle, or it seems to, have some sort of cycle every 2 weeks, every 3 weeks, every 4 weeks, whatever it is, then that's, then probably not related to your thyroid. Another sign would be you have acne, but you also have symptoms of other thyroid problems. Things like weight gain, things like hair loss, things like skin problems or dry skin, things like constipation, things like muscle pains, whatever, things like cold intolerance, things like low energy. Those are all symptoms associated with thyroid problems. And if you have those symptoms, plus you have acne at the same time, that's a sign that maybe those things are together. So if you just have acne, you have no signs of hypothyroidism or no signs of thyroid problem, it's probably not related to your thyroid, right? And then another thing that you should be aware of is that the acne from the thyroid typically is over the entire face. It's not regional. Now there's lots of things like you'll have the T-zone, you maybe have things, around your hairline, you may have issues just on your cheeks or around your jawline. Those are all ways to distinguish hormonal causes of acne, but acne from the thyroid tends to just be all over the face. In fact, it can be all over the body as well. I've had many women that I've treated who have had it all over the face, even on the back, even on the arms, etc. Now, the good news is this acne is treatable. The bad news is it can be kind of hard to treat, okay? So it's good and bad. But if you have acne related to your thyroid, definitely make sure you pay attention to every single one of these steps. I've been able to, in almost all cases, completely get rid of it, if not dramatically improve acne in women who are suffering from it. I don't actually see a lot of men, now that I'm thinking about it, who suffer from acne, even if they have thyroid problems. But I do see a fair amount of women who have this problem. So the first step, we're going to have 1, 2, 3, 4, 5 things that you need to look at. The first one is that you need to treat your thyroid correctly. Okay? You need to get a proper diagnosis and you need to get proper treatment. Most people who have acne related to their thyroid are probably not diagnosed correctly. Okay? In fact, there's a ton of people out there who have just low-grade thyroid lab tests, which are not easily identified by standard doctors, or they might have something called Hashimoto's thyroiditis. So if your doctor only orders the TSH and doesn't look at your thyroid antibodies, there's a good chance that you could miss a case of Hashimoto's because you didn't check for the right thing. So if in your case, your doctor might say, hey, I checked your thyroid, it's fine, even though it really isn't, because they forgot to order the right test, then you would never know that your acne was related to your thyroid simply because your doctor didn't do it correctly. Now, on the other side of things, imagine that you already have a diagnosis of the thyroid problem and of a thyroid problem, and you already know that your acne is likely related to your thyroid. There are plenty of people out there who are not getting the right treatment in terms of thyroid hormone. So thyroid hormone, thyroid meds, we'll call it thyroid meds here. Most people are on something called levothyroxine or Synthroid. Okay. Now the problem is many of these people are not going to see improvement in their acne until they get on something that contains T3. Now, in my experience, I tend to see the best improvement with pure T3 medications. So things like Cytomel and liothyronine. You can also use sustained release T3. Anything that has pure T3 in it. NDT is another option, so there are some other options here, but these tend to be the best. So Cytomel and liothyronine, relatively higher doses of T3 tend to get rid of that acne relatively quickly. And by relatively, I'm talking in the month range. Usually, certainly by 1 to 2 months, if you're on the right medication, you should see improvement. Then usually by 3, 4, 5, 6 months, you should see it really starting to clear up, if not completely go away. And the reason is it just takes a long time to get those really deep cystic nodules out of your skin. Like they're just really deep. They can't come up through the surface, so the body just sort of has to take care of them by itself. And most people, like I said, do better when they get their thyroid treated and when they use Cytomel or liothyronine. Those T3, the strongest thyroid medications available. That isn't universally true because, again, there are some people who could do well on T4, like levothyroxine and Synthroid, but most people are going to need that T3 if they want to get rid of it with that. So make sure you treat and diagnose your thyroid correctly. I have tons of videos talking about how to do that. Just be aware that that's number one for a reason. It's number one, the most important thing. The next thing that you should be looking at would be your estrogen and your progesterone levels. So remember I said that these kind of hormone imbalances can lead to acne by itself. And so estrogen and progesterone are predominantly their female sex hormones. So estrogen and progesterone tend to go up and down with your cycle. And one of the interesting things is as women age, their progesterone tends to drop relative to their estrogen, and their estrogen tends to go up in a lot of cases due to estrogen dominance. So things like weight gain, things like PCOS, they're all associated with a relatively high level of estrogen, and we call that estrogen dominance. So you want to specifically look at your estrogen and your progesterone levels. Look specifically to see if you have low progesterone, and look to specifically see if you have high estrogen. So what you'll find is that you might have a combination of both or just one or the other. Now these problems must be addressed. Now, what's interesting is that the thyroid does impact both these levels. So it may be the case that these are abnormal because of your thyroid, in which case if you treat your thyroid, those will get better. But it also may be the case that these are their own issues, which happens very frequently. And you can use supplements, you can consume the right types of food, you can manage your stress. All of these things can impact estrogen and progesterone levels. In fact, you can even potentially take progesterone if you needed to get that progesterone level up. But you have to be looking at these. You can order these with your lab tests. I would recommend getting them ordered when you check for your thyroid. So you order these both at the same time. Okay, that's number 2. Number 3 is that you need to look at testosterone and DHEA. So these are another set of hormones. So we have thyroid, we have estrogen, we have progesterone. Now we have testosterone and DHEA. Now both of these are considered androgens. Okay, so these tend to be more associated, or at least people tend to think of them in this way, as the male sex hormones. But women have them too. And they can, if they're in high levels, cause acne by itself. They can also cause male pattern baldness, and they can cause a reduction in the feminized traits that women experience, okay? So you want to have your testosterone be completely normal. High levels of these can cause acne all by itself, but they can also contribute to the thyroid. In fact, as I mentioned before, remember, thyroid problems can cause estrogen and progesterone problems, but your thyroid problem can also cause testosterone and DHEA problems. So these things are all really linked together. Again, these can be tested as well. So get your testosterone levels checked, get your DHEA levels checked, and you may need to take supplements to try and manage those. In fact, one of those would be something like zinc. So zinc can help with the metabolism of testosterone, which is why it's often used to help women with acne, hormone acne, or really any type of acne as well. Next would be you need to look at the potential for supplements, and you need to look at nutrient deficiencies. So I have some videos talking about important nutrient deficiencies, but here what I'm really talking about would be like zinc, B12, selenium. You can even throw a biotin in there. These are all nutrients which are important for proper skin health. And if you have any sort of deficiency in any of these nutrients, they may predispose you to developing or be more likely to develop acne. Now, what's interesting is that the thyroid state, so having the low thyroid state, whether it's diagnosed or undiagnosed, will increase your risk of developing these nutrient deficiencies, okay? Now, just fixing your thyroid won't fix the nutrient deficiencies. You'll have to take these supplements by themselves. This is why you'll see a lot of people taking over-the-counter supplements to treat acne. And this is true of people who have thyroid-related acne as well. Because again, it doesn't matter why you have the deficiencies. If it was your thyroid causing the deficiency or just a poor diet or whatever it is, you still have to treat those deficiencies if you want to treat the acne. So do look closely at these levels. Most of the time, it's just better to supplement with them because these lab tests are not reliable necessarily in all these cases. Sometimes they are, but most cases they're not. So do look at supplementation for nourishing the skin, but also look at supplementation for managing nutrient deficiencies. Then the last thing you need to do is fix your gut, okay? So gut health is really important when it comes to acne. There's a strong relationship between inflammation, certain bacterial concentrations, and manifestations of problems in your skin. That could be acne, it could be rashes, it could be any type of skin issue. But a lot of cases, gut issues such as leaky gut or inflammatory conditions of the gut will be associated with acne. Now, what's interesting is that gut problems can cause thyroid problems, okay? So you see how this is all connecting here? So you must address the gut issue. If you address any sort of gut issue, which you can use supplementation, you can use certain diets to help heal the gut lining, you can do all sorts of things to improve your gut and reduce inflammation there, and that will improve your thyroid, which may improve these other issues as well. But do not neglect your gut. You must be looking at that. You can take direct supplements like probiotics, prebiotics. You can take gut healing things like L-glutamine, which help heal the lining of the intestinal tract. All of those things are designed to help the gut function better and to prevent things that shouldn't be getting in through the gut, stop them from getting in. So that's really what the goal is here. So we have 5 important treatments that you should look at if you have thyroid problems, or if you have thyroid-related acne. And what I want you to know here is it's more than just treating your thyroid. You should still look at your sex hormones, such as estrogen and progesterone, the other sex hormones, testosterone and DHEA, nutrient deficiencies and supplements, and then, of course, gut health. So do all 5 of these. This will give you the best possible chance of getting rid of your acne for good if you do every single one of these things. So I want to hear from you guys now. Do you have or have you suffered from thyroid-related acne? Do you believe that your acne is related to your thyroid? Did you see any improvement when you started taking thyroid medication? Are you still having acne even though you've tried several of these things? So let me know. I want to see in the comments below what your experience is and how you're dealing with these things. And if you haven't already, make sure that you download my free thyroid PDF resources. I have tons of free information, all designed to help people with thyroid problems. So if you like this sort of stuff, you'll really like those. And that's all I have for you guys for this video. And otherwise, I'll see you in the next one.